Hi everybody, this is Dr. Haynes with Elite Foot and Ankle. What we're doing here is removing a painful toenail off the great toe of the left foot on a patient where this nail has been bothersome for her for some time. What I start off with is numbing the toe up with 5 cc's of a 1-to-1 mixture of 1% lidocaine plain and 0.5% marcaine plain. Prep the toe, and then as you see here, I start to just tease the nail off the nail bed using this elevator. And I'll sneak under the distal free edge of the nail with the elevator, freeing it up as much as possible. Next, I'll use this hemostat and see if I can't free this nail off. Sometimes it doesn't want to quite come off. It's a little more adhered. And so we have to free it up a little bit more. Let me grab my elevator here and we'll see if we can't free it up just a little bit better. I'll focus on these corners here and see if we can't get these loosened up. As you can see with the tourniquet, there's not a lot of bleeding typically seen with these. With the numbing medication, the patient typically doesn't feel any of this. There we go. Now let's see if we can't get this nail off here. One more try here. Just peel it slowly off that nail bed. Careful not to traumatize into the underlying nail bed or tear it too much skin around the nail folds. Trim off any excess skin here like we see here just to prevent any problems down the road. Once the nail is removed, we'll get some phenol here on a cotton applicator and just put it all along the base of the nail or nail bed, just under the cuticle, paying special attention to these corners here. The phenol is applied 3 times. This is our first application, and we do it for about 30 seconds each application. The phenol is a chemical that kills off the matrix, which are the cells that grow the nail. This 95–97% of the time should prevent the nail from ever growing back. Here we have our second application. Again, paying special attention to the corners and just underneath that cuticle. We want to ensure that the phenol gets over the entire matrix to prevent any regrowth of the nail. And now we'll get our last and final application. Again, paying special attention to the corners. One more sweep here. And there we go. So we've done our 3 applications. Now we're going to rinse the area with a little bit of alcohol. This dilutes out the phenol to help it stop working, and then a saline rinse to rinse off any remaining phenol from the area. Now I'll dry this up, remove my tourniquet. This will cause it to start bleeding a little bit more. However, it's usually still not too much blood. Once I've ensured the nail's completely off, typically it comes off in one piece, so it's not a problem. I'll clean up the foot of any dry blood from the procedure. And then I like a little bit of zero form, which I'll grab here to place on the nail bed. This keeps the gauze from sticking to the nail bed when the patient goes to remove their bandage tomorrow morning. And then a little Silvadene cream over the top. I like Silvadene because phenol does create a burn, and Silvadene cream works great for that. Some 4x4s over the top. Sometimes it takes more than others depending on how much it bleeds. This one is bleeding a little bit more than what I typically see. So we'll just add another layer of gauze here, and then we'll wrap it in Coban. And that's really all you have to it. The patient will remove this bandage in the morning. She'll start soaking it in Epsom salts, and she'll do that for about 3 to 5 minutes twice a day. Following the soaks, simple triple antibiotic or something similar, and just a simple band-aid to the area will do the trick. Pain is usually only tomorrow. An ibuprofen or Tylenol will do the trick. Then she can kind of get back to normal. Pain usually lasts maybe a week to a week and a half. It's more of a discomfort, but once that pain resolves, then the sensitivity is pretty much gone, and the patient can resume all activities as normal. And that's really all you have to it. Patient did great. If you have an ingrown nail or any other sort of nail problem, give us a call here at Elite Foot and Ankle, 503-668-5210. Thank you.